Hi, my name is Dr. Todd Cunningham. I am a psychologist with specialties in the area of school and clinical, as well as assistant professor in the teaching stream at the University of Toronto. I also head the school and clinical child psychology program at U of T. How I got here, being a psychologist wasn't my original goal. Actually, when I graduated high school, I went off to Trent University and enrolled in the concurrent education program there because wanting to be a teacher was my first love. Through high school, I really saw the impact that a teacher can have on one's life. That one special teacher that I had, Miss Turton, who really kind of directed me more into a way of being successful. And so seeing the impact that a teacher can have on an individual really made me want to enter that profession. However, as I went through Teachers College, I didn't feel like I was getting all the knowledge I needed to be as effective as I wanted to be. And at that time, I was reading some articles about some new reading interventions, remediation programs that were coming out about the Hospital for Sick Children, now the Learning Disability Research Program, headed by Dr. Maureen Levitt. And so I went and worked with her for a year. And as I did that, I really saw that psychology was an avenue that I wanted to explore. So the program I actually head up now was the program I went and did my master's and my PhD in. And through that, I really specialized in looking at academic interventions and assessments of learning profiles to really first understand how to understand the learning profile of the individual, but then what are the interventions that we can bring alongside to be able to support those students so that we can make them and help them to be more successful within the academic environment. I did my residency or my internship at the Hospital for Sick Children and my postdoc there too. At that time, I was doing work with students who had brain tumors. And part of my research that I was really looking at was looking at interventions for these individuals. We had the awesome science to be able to save them, but then the quality of their life was really impacted. And how can we come up with interventions to be able to help them be able to better have a better quality of life, especially in the area of academics. And so I worked under Dr. Don Mabbitt for 3 years and learned a lot there. Coming out of that, I returned to my formal program of the School and Clinical Child Psychology and started to, again, work in the university, as well as I started at that point my private practice. And as I started in the private practice, one of the key things that I saw was the need for us to have places that could provide the good evidence-based interventions that we had. It wasn't enough just to assess. We really needed to do the follow-through. And that's why I started Bright Light Psychology Clinic. It's a place where we can bring the best knowledge in terms of the evidence to bear to both understand the learning profile, but also to be able to bring about the supports in the area of academic, but also in the areas of mental health, so that we can get children and youth to meet their full potentials. So the Bright Lights team is made up of psychologists, doctoral students, individuals with their masters in education and special education, as well as teachers who really have a passion for the success of children. And we see that we need to not only work with the child or youth, but we also invite the parents and also the school system to really create a collaborative environment to ensure that we're all on the same page for the best outcomes of our clients.